Morning. Welcome to all our Temple Aliyah members and friends. And thank you for joining our special program sponsored by our Kesher Israel Committee. I want to welcome you to our webinar featuring a Magen David Adom update about Israel's response to COVID-19. I'm Arlene Breyer, President Temple Aliyah in Needham, Massachusetts, and I'm honored to be with you to welcome you to today's program. Magen David Adom is Israel's paramedic and Red Cross agency, serving as emergency medical first responders for the state's 9.3 million people. MDA is responsible for ensuring the safe processing, storage, and distribution of 97% of blood for people in the state and 100% for the IDF. We've all been watching and reading the news about how Israel is on the forefront of the pandemic, leading the world in its effort to vaccinate its population. During my last visit to Israel a few years ago, when I did the Arava Israel ride, I saw many MDA ambulances throughout the country. Thankfully, I never needed their services, but so many Israelis do. I know how critical they are in saving lives in Israel, and I'm proud to support such a vital organization that cares for all Israelis each and every day. I invite you to join me. Today, we will hear directly from Magen David Adom leaders who will join us live from Israel, moderated by Michelle Divon, a journalist who's working for a Dubai newspaper. But before we hear from our panelists, we'll watch a short film on their incredible work.
במד"א ישנם 28,000 מתנדבים, בהם פרמדיקים חופשיים וכוננויות תגובה מיידית.
מתוכם 13,000 הם מתנדבי נוער בגילאי 15 עד 18.
המתנדבים משקיעים 700 שעות כדי לקבל הכשרה מתקדמת. מתנדבי הנוער משקיעים 250 שעות.
MDA Paramedic Educational Center trains and certifies all paramedics in Israel, including IDF paramedics.
למד"א 169 תחנות המפוזרות בכל רחבי הארץ.
צוותי מד"א מיילדים בכל שנה מעל ל1,000 תינוקות באמבולנס או בבית היולדת.
I had a heart attack. An MDA app helped MDA paramedics to get to me in minutes and save my life.
Magen David Adom Blood Services are responsible for the supply of 100% of blood units to all the hospitals in Israel and to the IDF.
We are building the new Blood Services Center, which will save many lives in the years to come.
ב-2020 מציין 90 שנה לפעילותנו למען הצלת חיים בישראל ובכל העולם.
All right. I guess I will take it over from here. Thank you so much. Great to be back with everyone. I know it's early in New York, so thank you for joining. And I see we're quite an intimate group, which is amazing because that means there's an opportunity for everyone to participate. And I highly encourage you to submit questions so we can make it more of a dialogue. And I also have to say that it's the first time in I don't know, maybe a year, maybe since the beginning of the pandemic, that we're really feeling like there's light at the end of the tunnel, like things are starting to really look brighter. The numbers are down. The economy in Israel is starting to open up. I'm Michelle Divon. I'm joining everyone from Dubai, where I started working recently. And I just want to say that MADA makes us proud as Israelis all over the world. We are joined by two incredible senior MADA people, Shafir Botner, who's the director of Magen David Adom's Paramedic School. He's also a veteran MDA paramedic for 20 years, and also one of a handful of first responders that is serving in the helicopter service. So that is very cool. And maybe we'll have some time for you to tell us a little more about that. We're also joined today by Yoni Yagadovsy, he's the Director of International Relations, a senior paramedic and Jerusalem Regional Director. You have also served as the liaison to the Ministry of Health, the Ministry of Health's COVID situation room, which we will, of course, want to hear about, and we're sure you've been very, very busy. Shafir, let's start with you. So really a moment where, of course, we're being cautious, but we can be a little more optimistic. We're looking at the numbers, the graphs, infection rates are going down. Give us an overview of where things are now. Israel is leading in the global vaccination effort.
Well, thank you, Michal, and thank you for having me today, and welcome everybody. Good morning, good evening, good afternoon, wherever you are. So as you said, Israel now is quite more optimistic, in more optimistic point, looking about the near future. Of course, with the needed caution, we actually can see the infection rates going down. The number of positive cases each day is actually going down. And we, of course, think that the vaccine is one of the major things that make this a reality. And as you said, the economics is starting to opening. People are very easily, optimistically, and carefully going back to life. So if everything will go by plan, and what I mean by plan is, again, with careful, if it's going like it's going right now, we can see the light at the end of the tunnel, and we hope to celebrate Passover, which is very close, together with our families, and we are expecting our situation to be much better. But as I said, with careful, and why I'm always saying about this needed careful. We know the viruses, they know how to do the variants, as we call it today, the mutations. And right now, the vaccine is covering the famous mutation, the British one, and the South African. I know that those countries don't like that we are calling we're calling the mutation about after their names, but those are the mutation. And we hope, we pray really hard that there will not be a new one that the vaccine will not cover. So as long as this is the situation, it seems like we're going good, and we hope to be better in the next very near future.
I'm curious to know if Yoni, if you share the same cautious optimism. Things are good, but I do hear a bit of hesitation. How do you see things right now?
Well, I share the same thoughts with Shafir, because this virus showed us how nasty it can be, because we are now getting out of the third main outbreak in Israel, and each outbreak is much more problematic to us, affecting more and more people. The variations of this virus is a huge challenge to everybody in the world. Now people are talking about the New York variant and so on, and Brazilian, etc. But we do see the positive effect of the vaccination. We also see that the vast majority of the people who are in severe condition and hospitalized in the Israeli hospitals were not vaccinated, or they received one of the vaccinations. We are talking about less than 10% of Israelis that are in severe condition, hospitalized, that receive the first dose of the vaccination. So it means that it is working, and it is positively working. I'm sure that also the personal behavior of the Israeli public is a major contributor to that. And I'm sure that anywhere else in the world, people are fed up with all the restrictions that are imposed of them, the social distancing, the masks, and the fact that they cannot do whatever they want freely in the public. And I think that this is one of the tricky factors. The other factor is also that we know that part of the variants, especially the British variant, that is the most, let's say, existing variant in Israel over the last few months, where it was imported to Israel through people that came from abroad. And this is one of the biggest concerns, that whether to open up the sky to let people more come in or not, and what will be the effect eventually if the skies will be more open up with all the checkups in the airport and restrictions and etc.
You mentioned the British variant, and correct me if I'm wrong, and Shafir, we can, I want to focus on this for a moment. It's been, at least based on headlines, seems like one of the more aggressive ones. We see more hospitalizations, specifically pregnant women. This is something we've discussed. What do we know about the British variant, and why is it so brutal in Israel? Why has it really brought all the severe cases? And do you see the same thing in other countries? Do you have any idea?
Yeah, as you said, we saw the numbers are changing with the British variant, and more young people, kids, and as you said, especially pregnant women, became severely ill, and we didn't saw those numbers at the beginning or the first wave or the first variant of COVID that were in Israel and around the world. Why is that happening? That's a good question. What we for sure knows that COVID or the virus didn't read the book about the viruses, and he's not acting as we expected. We expected the virus to do mutation, and the virus also learned us to be modest and to be careful, as I said before. So part of the people, part of the population, especially the younger people, didn't want to get a vaccine at the beginning. And one of the biggest issues, as we saw it in Israel, is the British variant that was much more infectious, and people got infected very easily, even more than at the beginning, what we call it, the original or the first variant of the COVID. And of course, the effect about pregnant women and kids. So even though if they didn't have the illness in a severe condition, they still can infect the older people or the population that are at risk that didn't get the vaccines. So it was a challenge for us to convince all the young people that at the beginning said, let me see how it works with the older people, and then I decide if I want to get a vaccine. So right now, I'm happy that we are quite good with those numbers, and more young people are going to get a vaccine.
Well, Israel's vaccinating 16 and over. How's the response been among high school students?
The numbers are good. We are doing, actually, Magen David Adom is doing special operations in the high schools. We're going to high school to vaccinate teachers and students. And we're doing a lot of work with convince the people and giving them all the information and to rule out all the fake news that some people can see, read, and hear on the social networks and from friends. And as you mentioned before, when we were speaking, some special groups in Israel, the very Orthodox people or the Arab community that at the beginning, they didn't even want to hear about the vaccine. So we had to take all kind of special operations, we call it, to convince them to take the vaccines. Of course, we used their leaders, the religious leaders, to convince them. So we were the Magen David Adom people were the people that spoke with the religious leaders, with the people in themselves, with our volunteers in each very small community. And right now, happily, we are struggling with only 1 million. We call it the hard group of the missing vaccines that we still need to vaccine. Of course, all those above 16, we still don't have 30% of Israel population that under 16, but we're waiting. And as Pfizer CEO said that in about 1 month, they will get the FDA approval for a vaccinated population between 12 and 16.
Oh, wow.
So,
and I mean, you're saying I know MADA, first of all, MDA has members and paramedics from all communities, and you speak many different languages. So that, of course, helps to get and reach more populations within Israel, more societies. But maybe, Yoni, you can tell us what are these special operations? Like, how do you get to communities that are showing more pushback? The Haredi community, for instance, that's probably been most in the headlines. What can you share with us as far as MDA's tactics to really make people understand and actually go out and get the vaccine?
So as you saw in the video, Magen David Adom is based on volunteers, and we have volunteers all over the country from any known social group in the Israeli society and almost every community. So we have our, let's say, ambassadors who are highly trained, are capable, the people in the community know them, trust them, and if needed, use them every day as their immediate medical support. And when we reach the point that we need also to be involved in making sure that people understand how important the vaccine is and how it will assist them in the daily life, the members of Magen David Adom who are ultra-Orthodox and even ultra-Orthodox communities and neighborhoods were also the people who began to provide the data to their neighbors, to their friends, to their family, to their circles, social circles, and convince them how important it is. And they also showed their own personal example by receiving the vaccinations. The same went with the Israeli Arab community. We have a lot of Israeli Arabs who are working and volunteering in Magen David Adom. They live all over the places, also even in unauthorized or unrecognized communities of Bedouins in the Negev and so on. And they were part of this ongoing campaign led by the Israeli Ministry of Health and a lot of scholars from within the societies to convince people how important it is. The other step was to bring the vaccination to the communities, not to wait for the members to drive to the central vaccination places, but we have activated mobile vaccination facilities that came to the sites, to the communities, to the neighborhoods. Everything was organized and coordinated with the local leadership, and we make it simply accessible to everyone. By the way, that's the same thing that we did in the beginning by vaccinating the senior citizens in Israel who live in old age homes, nursing homes, etc. That was our initial assignment in providing the vaccinations. And then when we've done that and we vaccinated more than 200,000 people with the first dose and the second dose, and this is the community, the society that was the most vulnerable part. We were asked by the Ministry of Health to go further and to use our skills, abilities, and know-how to reach out to all the small communities, the minority communities, in order to make sure that they will also be vaccinated.
You mentioned Pfizer and the CEO, and these are headlines, but maybe you can give us more insight and a professional opinion. We saw that the visit by the delegation from Pfizer was postponed because the team isn't fully vaccinated, and Pfizer CEO wasn't vaccinated in the past. I don't know if he's received his first jab at this point. Shafir, how do you see this from, I guess, a health perspective?
The fact that the Pfizer CEO didn't get the vaccine?
Yeah.
As he said, he simply said that he's waiting as the rest of the people in the US to his turn, and the fact that he's the CEO of Pfizer doesn't mean that he can pass the line. I guess that this action has a lot of meanings, and of course it gave a little fuel to the anti-vaccines movement that said, look, even if the CEO of Pfizer didn't get a vaccine, he's not believing it. So that's made us...
It did add fire, but then, you look at the difference in access between countries, and it's very frustrating to see how, let's say, my parents who are now in the Netherlands don't have access to the vaccine. It's only 80 plus, and they're 70 plus. And in Israel, there's really widespread access. How come Israel has been able to be so successful in the vaccine drive?
First, we got a vaccine. So we had to have the vaccine first, and then we had to get all this operation to move and to take place. But why did we get a vaccine? That's a good question, and it depends on who you're asking, of course. Without entering political issues, of course, you can hear Israel Prime Minister always says that he brought the vaccines to Israel, but Israel also had some more advantage that I think in a scientific eyesight, of course, perhaps is good for Pfizer. We are kind of a small country, only about 9.3 million in Israel. And we have the system which calls HMOs, which is the small clinic that each person is located to, and we have all. I don't know what I have today. We have only four. We have only 4 HMOs in Israel. So each citizen in Israel have a computerized medical record, and you can actually follow the data, not personally about Shafir or Yoni or Michal, about the side effects or other illness that perhaps will be connected to the vaccine, and they can actually collect the data because it's computerized very fast. That's one thing. And because all those HMOs are spread all around the country, as Yoni said, it is very accessible for each person to get the vaccine, so it can take very fast. And so they can have all the data, all the information very fast and to learn, and that will give them the opportunity, for example, is the vaccine effective against the British variant? Can we vaccinate people with this or that or other medical conditions that we thought it was perhaps a problem? So they got all this data very fast and very effectively. So that I think that this was one of the initiatives that they brought the vaccines to Israel.
And it hopefully will bring Israel out of COVID first in the world. So some were saying it's a case study, but now it's really turned to the example of how to best handle, how to best vaccinate. Yoni, you're the liaison for the health ministry's COVID operation room, if you may. Can you share what it's been like working with the situation room? What has your day looked like? What has your focus been? How has the day-to-day work been during such a long, intense period?
Well, I think that the most interesting part is the fact that when Israel realized that the state is facing a medical emergency, and we are talking about a year ago, more than a year ago, immediately all the operational forces in Israel joined together under the auspice of the Ministry of Health and a certain party of the IDF to activate a think tank of specialists, not only in medicine, but also in data collection and etc. A lot of advisors, people from a huge variety of arena, whether it's medical or non-medical, including ourselves as Magen David Adom, in order to learn while acting and responding. And that was because it was new to all of us. And the fact that Israel is trained in this type of national emergencies, even though this was a different kind of a conflict, it wasn't a war, there were not missiles, etc. But the actual base for this type of collaboration exists. It is within the skills of all the ministries in Israel, especially the responding organizations. And that built up a huge capacity of a variety of experts, extremely interesting, to build up Israel capacities, how to respond, what will be the measure that we will use in order to understand whether this virus is expanding, what will be the criteria, what are the restrictions that we need to emphasize on, how to conduct the swab testing. This was a huge challenge for us. Magen David Adom was asked by the Ministry of Health to do the swab testing from day one. It's not something that we ever done before. We activate ambulances, mobile intensive care units, collect blood, use helicopters, train the public, respond to emergencies. We know that. But to stick a stick in somebody's nose, we had to train our people to build up the capacity, the technological abilities that these data of each person that was tested. In the beginning, we went to people's homes. In the outside the building, the person dressed himself up with this kind of a space suit and went up, swab tested the people or the family or whoever was there, put everything, arrange it correctly and send it out. Then we had to open up driving facilities in order to do it. But the data collection and sharing the data was also a huge challenge, and it was developed in-house in Magen David Adom. So it was
I hear you, Yoni, and I hear many different people within your field, army commanders, people who've dealt with terror, and really unanimously saying that this has been the most challenging thing, period, project that they've underwent. And it's almost strange hearing this, you know, as even as an Israeli, but I'm guessing as an outsider even more, because you're used to really dealing with all the different types of emergency situations, and then here really caught everyone off guard. I think many people are curious to know what Passover will look like. It's coming up, and also remind our audience to submit questions, as I see people already have. Holidays have been very different this year. Every holiday was something completely, whether isolated or just small, or just really people celebrated alone and not the way they were used to. It's still quite premature with vaccination, yet Passover is around the corner. Shafir, how do you envision it, and what should people be doing?
Well, as I said at the beginning, with very caution, I think Passover will be optimistic. We don't have any reason to assume that we're going to have bad numbers again or any kind of lockdown. Of course, not big celebrations, still with social distance, but I think families, that's of course not official state or something, but I think families, especially those who are vaccinated, can be gathering or can celebrate together, not like last year. Purim actually was a kind of a special, very special. Of course, we passed Purim already. We saw the celebration here in Israel on news. People were not listening. Not part of the people were not listening to the guidance, and we thought that 10 days later we will see a disaster in the numbers. But we were surprised, and not perhaps maybe not as we expected to see bad numbers. The numbers are good. The infection rates is going down. I'm quite optimistic, and as I said, I'm praying that we won't have a new variant or a new surprise around the corner before Passover. And very optimistic, I can say that kids can look up the Afikoman.
What are the current? Sorry, I'm not up to date actually. What's the limit in gathering sizes currently?
Well, in public, that depends where. Now we have what we are calling the green passport or the purple passport for home for workplaces. Someone who is vaccinated with 2 doses is getting a green label or green passport, and he can enter some most of the places, restaurants and theater, which is not open yet, but it should be very soon, I hope. So the numbers are depending where are you doing that, and if you are in a closed place. But if I would, as I said, very carefully, I would say if you are part of the family members and you are vaccinated, you will have the opportunity to gather on Passover.
All right, something to look forward to. Yoni, so another topic that's been dominating headlines, especially internationally, is the issue of vaccinating Palestinians. Israel recently began vaccinating Palestinians that work within Israel. There's been some criticism. However, some people will reference the Oslo Accords that say that it's not under Israel's jurisdiction. So just from an MDA point of view, how do you see the vaccination of Palestinians? What's happening in practice? I know the army set up some places. And do you know what the plan is moving forward?
So first, let's divide between Arab Israeli citizens that are Israelis and those who are living in the West Bank or in Gaza and so on. So basically, each authority needs to take care of their own people. Like Israel is taking care of the Israeli general public for a long time. Therefore, the Palestinian Authority should do the same for their own people. Israel was assisting from day one. We even trained people from the Palestinian Red Crescent in Jerusalem, in East Jerusalem, in the early days, how to take swab tests to the villages around Jerusalem, let's say beyond the jurisdiction of Israel and so on, because we share the same abilities and the same values. When it comes to vaccinations, it's a completely different ballgame, and all over the world, it's a huge struggle to receive vaccinations. What Israel has decided first is to assist and to bring over vaccination that were received in Israel, either through Jordan or through the airport from other countries designated to Palestinian Authority. Israel did it immediately, sent it over with the coordination mechanism office. And then, since the tens of thousands of Palestinians who are working with a permit in Israel, every day they come over to Israel, they work in construction, they work in other things, they work even in hospitals. It was clear that those have to be vaccinated. And over the last couple of weeks, there were places open up in certain checkpoints between the West Bank and Israel, where these employees are being vaccinated, Magen David Adom is also taking part in this project, and we vaccinated the vast majority of these people alongside with the IDF. The response is fantastic. I mean, it's nearly 100% vaccinations, because we live in the same ecosystem, health ecosystem. So those who are coming over to Israel, it is our duty to make sure that they are vaccinated.
Okay, I'm starting to embed questions, and I see that we've already answered some. So forgive me for not giving credit to the participants, but thank you for submitting, and please continue to. This kind of pertains to what we just discussed. Arlene Breyer is asking if there was an Israeli reaction to Saturday Night Live's joke about 50% vaccination rate in Israel. I don't know if this was a big topic in Israel, but basically a lot of pushback from ADL and different groups saying that it was anti-Semitic because they added 50% in Israel has been vaccinated. We know which half, meaning the Jewish half. Was this something that was discussed, Shafir?
Actually, I didn't heard about it very much in Israel, but I saw another show in the state, the South Park, which also comment to the vaccination and did the opposite joke, and they were of course talking about the huge vaccination operation in Israel. But of course, it's a joke. Of course, that's not a matter of facts. The fact that more than 50% were vaccinated in Israel from the whole population. And if you can take on the potential population to get vaccinated, it's of course more than 15%. We have around 2.5 million kids out of 9.3 million. So the rest, we already vaccinated 5.5 million, and the rest of them are, as I said, the missing million, and part of them people that were already COVID positive. So those are jokes, and that's okay. That's a good part of our life.
I also think that this has given Israel so much press, leading the world in vaccination. All eyes have been on Israel. Third lockdown. So I can't remember ever having such major publications write about Israel, from Wall Street Journal to New York Times, SNL, South Park. Some people say that no publicity is bad publicity. So at the end of the day,
sometimes jokes don't work in certain crowds. But that's okay. People are entitled to express whatever they want if they think it's artistic or any other way. I must say, we had a lot of jokes here domestically that other people will not understand or might cause a problem to a certain group. But as Shafir said, the down fact is that vaccination is going on, and medical services are provided equally to everyone. And by the way, a lot of the people who work in the hospitals and in the clinics are Israeli Arabs.
Right. Right.
That is very important to note. And maybe among the Jewish community, that's a known fact, but beyond it, it's definitely always surprising to people. Question from Lior Bernoon. He says, we've heard that the nationwide hospital capacity was tested this year. We all remember that. How is the hospital infrastructure holding up today, Shafir?
Well, today the numbers are decreasing. They are much more easily can act. There's less and less people that are severely ill. And we can feel it. We actually can feel it. We can see the overload is going down. And we can see, of course, Yoni see the numbers every morning and every evening, I think. And we have a special report like every day about the hospitalization, positive vaccines, all graph and numbers. As I said, the numbers are great right now. Let's pray and hope.
Indeed. Next question from Lori Bandreamer. After the country is mostly vaccinated, what does normal look like? Are masks still required? If so, for how long? And I think we know it's a new normal, but I guess the question is, if I can kind of add some of my own take, when can we expect to experience life as it was? Can we, Yoni?
I think that it will take time. We need to carefully know within the next year or more how efficient and how good is the vaccine, are there side effects, long-term effects, what this virus is causing again and again to keep us on our toes and so on. In terms of masks, we still continue to walk around in public and in gatherings, etc. with masks. It is mandatory, even though there are people saying, no, it's not true, even if from specialists who say that if you are vaccinated and so on, you are pretty much protected. We also know, by the way, that is a minor point something % of the people that were fully vaccinated that unfortunately were affected, and some of them were even severely sick. So we are not on the safe side yet. I can tell you that restaurants open up in Israel, theaters have been opened up with a lot of restrictions. Even soccer games are becoming again with public, which is something that caused a lot of fuss over the last weekend, but also with really small amount of people who are allowed to see them. And it's simply the main matter is what is the level of people who are becoming sick again and again, taking as into consideration, as Shafir clearly said, that 1/3 of the Israeli population cannot be vaccinated, and they can become sick, and we see them becoming sick because schools are open, and they can pass it on to others. And the level of protection that the vaccine provides is still being learned and tested. So we have to wait and see and be patient, which Israelis cannot be.
Israelis not patient? What country are you talking about?
What is patient?
Exactly. Patient who?
It's something that we don't have. We don't know it.
This is true. This is true. We have our advantages and disadvantages. Another question, because we have a bunch, and I'll also say that I think this intimate audience is one of the best we've had, very high engagement. So thank you. Lior Barnoon asking, how has the national security landscape changed since the lockdowns? What about non-security, non-COVID related deployments? We of course know that MDA is in charge of any emergency, heart attacks, car accidents, etc. Shafir.
Well, those cases, of course, are still here with us, but we saw the impact of COVID about that. At the first wave or on the second wave, people didn't want to go to hospital, of course. They were afraid. They were afraid about going to hospital, get infected by COVID, stayed at home. We saw those numbers all around the world. Actually, we see much more what we're calling out of hospital cardiac arrest. The percentage was higher than each year. People just stayed at home, got their heart attack or brain attack, stroke, and didn't go to hospital. That's, if I can also add to Yoni's answer from the last question, I think that part is going to change our medical life. People now have their opportunity not to go to hospital. The using of telemedicine is much more popular. Now we're even implementing it in Magen David Adom. We are starting a very huge and new project of operating telemedicine with the ambulances team, not only emergencies and urgencies cases that have to go immediately to the hospital. We can actually take care of people at their homes. They will see a doctor through the video chat. He can check their blood test, urine test, nose, throat, ears, listen to the lungs, listen to their heart, giving them a first treatment and medication, and they will stay at home. So right now, I think the emergency cases are coming back to normal. People are going back to normal life, and the numbers are growing again. We are seeing the normal numbers that we're familiar with. And above that, what I said, the telemedicine is our next big project.
No, I mean, during COVID, there were still people who had other illnesses and conditions, but people were, of course, scared to go to the hospital, maybe scared to call. So that's definitely a good sign. We have a long question from Janine Eagle, or a long comment turned into question about lockdowns and how we can create a safer hybrid version of a lockdown, because the moment you open up again, there are many gatherings that can happen indoors, which might escalate the situation and amp up infection rates. So, Yoni, first of all, do lockdowns work? Because I see this is something that's debated. Do they work? I know that every lockdown in Israel was a little bit different. And then once going out of a lockdown, how do you ensure that there isn't an immediate uptick because of these indoor gatherings?
So it is really a huge debate around it. If you compare, let's say, a year ago, the last Pesach lockdown was extremely efficient. People were afraid. People obeyed to all the rules. People stayed at home. And we saw very quickly the numbers going down in terms of people that were tested positive, etc., and so on. But the peak then of being people sick was pretty much the baseline that we are now in. And then things opened up without vaccinations, without anything, and within a very short time, it came back to us again and again. The second lockdown was much less obeyed. People became to be tired a bit. I know better, don't tell me, I know what to do, and so on. Because we didn't have the right protection as we have now with the vaccinations. And as I said, it still is questionable. It still is a limited level of protection, but much better than the mask and washing your hands and social distancing and so forth. I'm sure that without the lockdown and the fact that we are being imposed with social distancing, we won't be able to control the disease, that's for sure. We were not able. And the fact that we saw at the last outbreak, the third outbreak, the high numbers of people affected. We've reached, in 2 weeks, we came up close to 10,000 people that were tested positive a day, which is way beyond anything. And the death toll rose up. And the fact that hospitals in Israel began to feel that they are overwhelmed. And we began to see here in Magen David Adom what we saw in New York about a year ago, that ambulances are waiting in line outside hospital for hours until their patients were admitted. And for example, in Jerusalem, we had to, from home, take positively tested patients with severe signs and symptoms to hospitals in the Tel Aviv area, in Rehovot area, because the Jerusalem hospitals were overwhelmed. This is something that we cannot allow to reach out to again, because the wear and tear is tremendous. Add to that the fact that each lockdown and all the restrictions are causing huge of social issues to all ages, especially to the young ages who are not going to school and staying for hours and days at home. To their parents, there's a lot of issues with domestic violence and other things, lots of continuous education, value of life, meeting your peers and your friends. So, it goes either way. We hope that we will not have to go back to a fourth lockdown, but we can never really know and tell whether it's going to happen or not.
Yes, we can never tell. That's why it goes back to question one and the cautious optimism. Yes, Shafir, you want to add? And I do want to interject some more questions, if you don't mind, because we're running out of time. You can comment on that, but I will also interject Susan Schiller's question asking when we can anticipate publishing of the findings. Israel has had, the best data to offer. How many months or maybe even years? Do you think it'll take until we have a really kind of clear picture, Shafir?
Well, in terms of finance, I don't know the question. I don't know or the answer. I hope as fast as we can. There's a well. I'm not the person to ask. I think in finance, if
not finance, like when will there be findings? When will there be, conclusive?
I think we're still in ongoing process. We're still learning. The disease the virus is still changing, and that's the $1 million question. Are we going to, as you said, to eradicate COVID at all, or we're going to live together with the COVID for forever or for several years? That's the $1 million question. I don't think no one knows the answer. If most of the world population will be vaccinated with no new variant, perhaps we will have the opportunity as a world to eradicate COVID. But if not, as perhaps expected, we will have from time to time new, more violent variant, perhaps not with very high infection rate. So I don't know. That's a very theoretical question. And
I think it's actually, thank you for that answer, because the biggest experts in the world don't know. And there are a lot of things we still don't know. And that's something we have to keep in mind and just have that patience.
What I can add is that there were, about a couple of weeks ago, there were two big researches that were published, that were done here by two of the HMOs about the efficiency of the COVID, of the vaccination. And the results were very high. They were published, I think, in the New England and somewhere else about the efficiency of the COVID, of the vaccination and so on. But long-term research, we are not there yet for the long-term research. And it will take time to know more, especially about the side effect, the long-term effects that people suffer from, by the way, from that were sick with COVID and so on. This is another thing that we will need to deal with and to learn how to cope with it. The modern medicine will have to learn how to cope with it.
I think for the next year, it's for sure with us in some way.
Yeah. I have time for one more, not even. So we're going to quickly just take one more because there are so many good questions here. COVID cases among MDA who are dealing with patients. Were there a lot of cases? And did that happen before there was a lot of understanding of the disease? If there's anything else you want to throw in, go ahead, because we don't have any more time. But yes, how did the staff deal with COVID?
Well, at the beginning, when, as Yoni said, we were wearing ourselves with a spacesuit, we almost didn't have any cases in MDA when we know who is positive and who can infect you. But as time goes, we had more and more MDA people that were positive, and not from work, what we are called social infection. People finishing the shift, going home, if it's not locked down, perhaps going to some places and got infected, and even they don't know from where and from who. And like the rest of the population, we had staff from Magen David Adom, which were positive to COVID. But I think now we're in a good place. Most of our people are vaccinated. Not a lot of people are in home quarantine or positive. And overall, I think MDA staff was in quite good condition on this issue.
Yoni, final thoughts?
Well, I do agree with Shafir. It was challenging to all of us, especially since let's take our call centers. Magen David Adom became the national referral call center for COVID, and people were extremely concerned. I mean, on a regular working day, we used to receive about 6,000 calls on our 101 emergency phone number. all of a sudden it became 20, 30, 40, up to 82,000 calls in one day. Meaning we had to bring in lots of people, many of our volunteers that were trained to answer these calls and to work while trying to maintain the best quarantine working condition for the people. And that was extremely challenging. When you go back home, you can get affected with your neighbors, your kids, etc. And that was a very big struggle, by the way, to the entire Israeli medical society, because there were times that a certain hospital had a big number of people that were affected or needed to go to quarantine because they were exposed to somebody that was tested positive. And this is a challenge of our life. And I think it's going to be a challenge for all of us pretty soon within the next year. But may I add one more thing?
Please.
One of the reasons that Magen David Adom was ready and was able to respond the way that we have responded and to take all the responsibilities that we were asked to do is because of the assistance, the long-term assistance and donations that we received from our friends and supporters in the US. Because we had the training facilities, we had the ambulances, we had the medical equipment, we had the technologies. Our blood services had the abilities to collect plasma from people who recovered and to provide convalescent plasma to the hospitals in Israel. We were ready to do it and we were able to do it because for years and years, you, our supporters, gave us the abilities to build up our capacities. So you are partners to what we do. And because of you, due to your assistance, we were able to do what we are still doing. So thank you for being our partners and thank you.
Yoni, Shafir.
And happy Pesach. Enjoy.
Yeah, happy Pesach. And a happier Pesach for sure. One last quick thing, yes.
What I thought from this crisis, first, stay modest, even though you think you know everything. And this situation, this crisis, made us to take the best out of Magen David Adom and out of us. And that was our opportunity to see everybody how Magen David Adom is working great with your support.
And just to say, Yoni and Shafir, thank you so much because you have extremely busy schedules. It's been an intense year and you always make time to come and answer questions. So we really, really appreciate it. It's such a pleasure hearing from you. You're on the front lines, literally. Toda. Thank you to our audience. Thank you to Arlene Breyer and Temple Aliyah for hosting us this morning. As mentioned, MDA, not a government agency. It receives donations and really needs donations from people like you and me. So anyone who would like to make a donation can go to www.afmda.org. I'd really like to thank everyone, also on behalf of MADA, the leadership, the courageous paramedics and doctors and EMTs and volunteers from all sectors and the blood service staff. Thank you so much. It's really nice after a year of going through this and having these discussions to leave on a bit of a different note. Toda rabba, and really, it's such a pleasure to be able to support you. So thank you to everyone today and have an amazing rest of your day or evening, wherever you are in the world, and early Chag Sameach.
Chag
Sameach.
Bye-bye.